Hello, I am Dr. Marge Joaquin-Sibayan, a certified international breastfeeding and lactation consultant, a nurse, and a partner of Smile Train. Today, I want to assure you that it is indeed possible to breastfeed babies born with cleft lip and palate. Breast milk is the best food for our babies. During the first 6 months of age, we should feed our baby breast milk exclusively, and after that, start complementary feeding. Breastfeeding beyond 6 months provide babies with nutrients to help them grow and antibodies that protect them against diseases. Babies born with a cleft lip, cleft palate, or both can breastfeed directly by adjusting how they are latched and positioned while nursing. Babies born with cleft palate may not have enough suction strength to draw enough milk from the mother's breast. As a result, they may need assistance from the mom through manual breast compressions while they latch. Another way to ensure that baby receives ample feeding is through alternative feeding of expressed breast milk. This means that the mother extracts her milk with her hand and offers it to the baby with a syringe, spoon, or cup. In some cases, and if recommended by the lactation consultant, it can also be offered with a supplementer at the breast. In order to do this, there are 2 important things we need to know. First, milk production relies on the amount of milk taken from the breast. To establish a supply, moms should breastfeed directly regularly or empty her breast 8 to 12 times in a day. Only this way can she regulate the amount of milk she produces every day. Second, expression of breast milk is best done at regularly scheduled times in between feedings when baby is calm or sleeping or when unable to breastfeed. After washing her hands, mom will calmly express from both her breasts, store it in a clean bottle or a container of sterilized glass with a lid, and store in a cool and dry place so that when baby wants to feed, breast milk is ready at room temperature or body temperature. When the baby has finished feeding and is calm, mom will extract milk again, save it to have it ready for the next time, and so on. We call these lagged intakes. For breast milk manual extraction, there are 4 points to remember. First, it is important to wash your hands with soap and water or alcoholize just before collecting your breast milk. Second, it is best to do breast milk collection in a comfortable space where you have privacy and where you are relaxed. Third, deep breathing and conscious breathing helps the moms with milk flow. It is also advised for moms to look at baby's picture or even smell clothing worn by baby. Fourth and last point is to know the proper positioning for your hands when collecting your milk. Imagine your breast as if it were a watch. This would be the 6 o'clock position, the 12 o'clock position, the 3 and the 9 o'clock positions. Put your fingers on the 6 o'clock position and 12 o'clock position, pull back towards the chest, and press the fingers together. You have to do this with a specific rhythm to ensure a milk flow. If the milk slows down, you may transfer your hand to the second position, that is the 3 o'clock and the 9 o'clock position. We tell the moms to ready a cup or a bottle and place it underneath the nipple so that as milk flows, you'd be able to collect your breast milk. Now, here are 4 recommendations for maintaining and increasing breast milk production. Drink between 2 to 3 liters of plain water each day. The amount depends on the needs of the mother, and drinking water helps her stay hydrated and gives the body better conditions to produce milk. However, what increases the production is not the intake of water itself, but the direct stimulation done when breastfeeding and expressing. The greater the demand, the greater the production. Massage the breast to help stimulate milk flow and to facilitate breast emptying. A warm bath or shower may help relax mom and make milk flow better. It is best to hand express breast milk in a comfortable and relaxed environment. With shoulders relaxed while breathing calmly, mom can think of baby, smell baby's clothes, or visualize milk flow to facilitate letdown. Alternative feeding methods may be employed to feed babies with cleft. Cup feeding, spoon feeding, dropper or syringe feeding are favored because it supports breastfeeding, helps the development of neurological and orofacial muscles needed for speech and mastication. It also prevents aspiration, overfeeding, and avoids unnecessary pressure on the post-operative site, especially after lip and palate repairs are done. It is important to feed baby in an upright position with the back and head supported while allowing baby to pace the flow of milk. Skin to skin should be done as often to promote milk production and foster emotional development and bond with mom. And finally, it is important to mention that if for some reason you were not able to breastfeed and want to do so, relactation is very possible with skilled guidance. In the case of families who make the informed decision to give formula instead of breast milk, you should consult your primary care provider for the recommended dose and the correct way to prepare it, and feed baby using the alternative methods discussed previously. The decision depends on you as a family and several factors. But you need to know that if you decide to breastfeed, yes, you can. For more information, you can get in touch with Smile Train. We will be happy to help.